indeed a response to those who come here to seek medical treatment and they have to submit information, for example, on their health. So are you saying that based on that you would reject those applications and they won't be able to enter Singapore?
So it will depend on their health status.
Okay.
So if there are indeed cases of, depending on their health information that they submit, we may very well reject the application before they arrive here, right? Because the main objective, besides reducing the number of infected cases, we also do not want a surge in numbers of people coming into Singapore who may well be symptomatic and then coming here to be tested and to be treated here. We understand why they would like to do so, and we would certainly like to help them, but if there is a sudden surge, we don't have the capacity to do so. And the capacity of our healthcare system must be prioritized for Singaporeans. So that is the reason why we now have this additional requirement in place.
Thank you, Minister. Aradhana from Reuters. Just wanted to check with you, is this the first time Singapore has ever issued sort of a blanket advisory to avoid all non-essential travel overseas? First question. Second question, you mentioned the people who are coming to Singapore to seek treatment. Possible to give any clarity on from where they came or the case numbers? And third one is obviously the elections have been a hot topic. The opposition parties are urging the government not to hold elections during the outbreak. Just wondered if there's sort of a risk assessment that the government is doing about holding an election potentially during the outbreak.
What was the first question again?
Is this the first time Singapore?
First time.
Yes.
I don't know if it's the first time. I would imagine so, because I don't know of any other time where we have dealt with a virus of this nature that is everywhere in the world, and it's the scale, the magnitude, and the severity. So I would imagine so, but we can go back and double check the facts. Second question on which are the cases? I don't have the exact case number, but if you look at the daily reports that we put out, you would find that there are cases who are literally on arrival, sent straight to hospital. Those are the ones who already knew they were symptomatic. And they are not coming on private jets, they're coming through commercial airlines. The airlines obviously deem them fit to travel. So even if you were to ask the airlines to check, somehow, the airlines will not reject everyone. So they are deemed fit to travel and they come to Singapore. And when they arrive, there are some who literally are sent straight away to NCID and to the hospital for treatment. And the facts are in which case number, which are the information on the cases you can see from the previous daily reports. So we've had some of these cases. We are concerned that the numbers may go up. And while we understand, like I said earlier, while we understand why people would want to come to Singapore for treatment, and we would welcome them in any other circumstances. But given the nature of the situation today and how pressing it is and how the numbers are growing everywhere in the world, we do think this additional precaution that we have just put in place is necessary.